because of the pandemic and some of the anxiety. If we're not experiencing it ourselves, I'm sure everybody knows someone who has had some adverse effects due to all that's happening with the pandemic. And additionally, this is Mental Health Awareness Month. The month of May is Mental Health Awareness Month. So due to the combination of those two, we thought this would be an ideal time to hold this forum from the Miami Beach Democratic Club. And we're fortunate to have two professionals from the mental health community with us today who will be part of our discussion and sharing their wisdom and knowledge with us during this next hour. We have Dr. Azam and Dr. Soto-Yulfo, who will be participating just for the flow of the event. We are going to be, Cheryl Unger is the other moderator for today. Cheryl, everybody knows her, I guess, Cheryl Unger, who is a part of the program committee. Before I go any further, I see that there are quite a few members from the leadership, either they are board members or leadership members. I know I see some of you don't have yours, it's not showing yourself, so it's kind of hard to wave when you're not on the screen. But if you are a board member or on the leadership team, just raise your hand so people will know who you are. And we do appreciate all of you coming today to be a part of this event. Like I said, Cheryl is also going to be a moderator. And what we're going to do, if anyone during the early part of the presentation, while Cheryl and I are posing the questions to the doctors, if anyone have questions, please put them into the chat and we will be monitoring it and try to answer some of the questions as we go along. Otherwise, at the end of the evening at about 7:45, we are going to open it up for anyone who may have questions that they can bring up the questions to the panelists. So with that said, again, thank you very much. And, before we get into the meat of the presentation around, mental health, I thought I would share with you all some recent information around healthcare, not specifically healthcare, but it will include mental health, some new legislation that has been recently implemented by the Biden administration. Some of this information you may find useful for yourself. Otherwise, you may find it useful for someone that you may know. So if we can share that document on the, it's supposed to be a shared document right now. Steve, can you get it to share or no? If you can, I'll just talk about it. Okay.
Oliva is working on sharing the document.
I'm working on sharing the document. Just give me 1 minute.
Okay. Well, okay, here we come, I guess. All right, there we go. People may know that normally people buy insurance on the individual healthcare market, they can only buy it during open enrollment season, which starts in November and December. But due to the pandemic, the Biden administration, they have opened up the platform so that people can buy individual healthcare on the marketplace through August the 15th. So it's a special open enrollment that people who may need healthcare, they can buy it now instead of waiting until the end of the year. The next item is part of the American Rescue Plan Act. And under this, and this can be really valuable to some people because anybody who was involuntarily terminated from their job starting November the 15th, the government will pay for their COBRA insurance. Their COBRA insurance that was offered through their employer, the government will pay for your plan for the 6 months period, April the 1st through September the 31st. So if you know anyone who was involuntarily terminated, they can keep their insurance during that 6 months period, or if they are already on COBRA and want the premiums paid, or if they did not previously elect COBRA, they can elect COBRA now, and the insurance is paid at 100% for these 6 months. So that's a real value to people. And also, anybody buying insurance on the marketplace or is eligible to buy insurance on the market, an individual policy, right now, only people who earn up to 400% of the federal poverty level would be eligible for a subsidy from the government. And the 400% of the federal poverty level is about $51,000 a year. So anybody earning anything below that would be eligible for subsidy. But under the administration's new guidelines, you can earn a lot more than that and get a subsidy from the government. So if you know anyone who is already getting a subsidy from the government, is already getting a subsidy for their COBRA, so for their individual policy, they may want to go back to the marketplace and see, are they eligible for more subsidy? See if they're eligible, because there's money there. They expect that around 2 million people will be eligible to get healthcare insurance at a discounted rate or with the subsidy with this new plan that is part of the American Rescue Plan Act. So it's a great opportunity for people who may need healthcare. And if anyone is earning about 150% or less of the federal poverty level, their insurance is free. The government picks up 100% of the cost for that. So this may not apply to anyone here, but if you know someone who may need healthcare, need a subsidy, this is an opportunity for them. And this is just a very high level. If anyone wants more information on it, please feel free to reach out to me. I will put my information in the chat box. Most of you all know how to contact me, but if you got family or friends who need some guidance, I'm always available to give recommendations and to help people guide them through the process. Okay, very good. So again, government is working for you under the Biden administration. Is all good. And I thought this is very timely for this discussion because there may be people who need healthcare treatment, mental health care treatment, and they need insurance plans to help them cover the expense. So this is an ideal time for them to make sure they go out and get the insurance plan that's most appropriate for them. So with that said, we're going to move on into our presentation. You can close that out if you can, Olivia. There we go. Okay. So I've been talking, so I'm going to pass the baton to Cheryl and let her ask a few questions of our panelists.
Okay. Well, first I want to welcome everybody for coming and for endorsing this as a program. What I want to do first is obviously thank our guests for speaking and just give them an opportunity to share their own personal background a little bit and the focus of their practice and specialty area as it relates to mental health and your experience of living here in South Florida. So Dr. Azam, you want to go first for a minute or two?
He's muted. Dr. Azam, you're muted.
Unmute. Okay. Can you hear me now? Can you hear me?
Yes, we can.
All right. Thank you for giving me the opportunity. I was born and raised and grew up in the Pashtun part of North Pakistan, which is the Afghan border, in Peshawar. I did my medical school there and did my first residency in psychiatry in London, and then moved to the US in 2005 and completed my residency at SUNY Downstate Brooklyn and a child fellowship year at University of Florida, Gainesville. I moved to Miami in 2013 and started my private practice and have been working with children, adolescents, and mostly adults. As a generalist, I treat most of the psychiatric conditions ranging from anxiety, depression, bipolar, schizophrenia, ADHD to any general conditions, and specialize mainly in mood disorders and cognitive and focus issues. Yeah.
Okay, thank you very much. Dr. Raul, just give us a little more background other than what we've read about on the on our invites.
Yes, basically good evening, everyone. Thank you for having me for this presentation. Basically, I graduated in 2017 from Albizu University here in Miami, Florida. But I did my bachelor's degree in education. Then I moved to psychology. I did my master's. Then I did my doctoral program. I did my residency at Citrus Health Network, mainly with substance use population. And then now I'm doing my fellowship hours with 2 independent private practices, where basically we treat in the South Beach one, Allied Psychological, we treat mostly adults. And basically the most of the caseload is via telehealth at this moment. And the other practice that I work with is in Homestead, Keysgate Wellness, and they have a broad range of individuals from children up to adulthood. And my specialty is with adults, individuals, and I also work with couples.
I'm sorry, what was that last comment? With who?
I work with individuals, and I also work with couples in couples counseling.
Couples.
Okay. Oh, couples, got you. Okay. All right. Thank you very much. Okay, so that does help us understand who's speaking. All of us have either seen on the news or reading it or dealing with personal friends that have, or just even ourselves, are been feeling a whole lot of things during this pandemic, from fear to anxiety to maybe lapsing back into some addiction behavior. So I'm just curious, from your perspective, what are the kinds of things you're seeing? What are you most concerned about? And how have you all been dealing with patients coming to you? Why don't we go first with Dr. Soto-Yulfo?
Okay. Basically, the more impact that I've seen is in anxiety disorders, following depression, and also some sort of cases with PTSD related to the pandemic. The anxiety disorders, basically a lot of adjustment disorders with anxiety, and increment in generalized anxiety disorders. That's what I've been seeing the most. In terms of adolescents, there is a lot of adjustment disorders because of the situation with having to change their schedules around school, now doing everything via video conferencing. So the lack of being able to socialize as they were, that is affecting a lot of adolescents and children in general. In terms of couples, I've seen a lot of adjustment disorder with anxiety, and also increments in anxiety in marital relationships as well.
Not surprised. It's too much time alone with people. Exactly. Dr. Azim?
Yes.
Where'd you go?
Well, you know,
Safir Azam.
yes, this pandemic came as a shock to the modern world. You know, we were in a bubble of this faith, this kind of security that we are in a safe world, and pandemics only happen in some certain parts of Africa, and we are safe. When it arrived, there was first shock, and later uncertainty was the number one thing that really rattled patients. And that, as Dr. Soto is saying, led to anxiety and PTSD. There have been positive and negative effects, I would say. I saw not only increase in anxiety, especially patients who have been prone to health-related anxiety like hypochondriasis. Their condition became very worse. They would not even get out of their apartment or touch anything, or even deliver things. Now, when things would be delivered to them, they had to clean. It led to also the second most common thing was sleep disorders, difficulty falling asleep, difficulty waking up, because the whole schedule got changed. The whole reality of the world changed. People started working from home, businesses closed. So they would be on Instagram. Of course, TikTok took a very much of became a big hit, and people started sleeping at 4 a.m., waking up at 11, feeling tired and related. Then the focus and concentration became an issue. People had to focus from home on computers, and the demand increased because what happened, there was so much anxiety and uncertainty that a lot of jobs were shed, and certain employees were kept in the offices, and they were given increased amount of work, because then they were saying, well, you can just work from home. So the expectations were more high. On the other hand, I did see certain patients doing better, those especially who had social anxiety or who had public speaking anxiety, who had to go to office every day and face their bosses. They were actually feeling better working from home. Another condition I saw was people with schizophrenia and severe bipolar disorder. Several of them made comments, Doc, now you know, now the people know what we go through on a day-to-day basis. Before, we were never understood. Maybe some of the people might be able to understand us better, you know, of what we go through on a day-to-day uncertainty. So apart from that, of course, children had a sigh of relief having not to go to school at 8 a.m. Teachers complained that they had difficulty keeping students on task through video Zooming. Depression got worse in certain populations. It did get better in certain populations. But overall, the sleep disorder, the routine, the day-night sleep-wake cycle disorder got worse. Yeah.
I agree with the sleep disorders because basically every one of us has been changing our schedules. Now working from home is more work than just going 9 to 5 to an office. So working at home, the boundaries, the limits, they get more expanded. Therefore, people will be working more. I've seen also a lot of burning out in certain professions, especially healthcare professionals has been very burned out in terms of the extensive hours that they have to work, and working with the pandemic situation. Also, substance use is another increment that has been very, very noticeable in especially alcohol consumption, opioids, cannabis, and you name it, basically all the substances. Some of them has been increased more than others because of the fact of the availability. Now it's easier to get certain substances compared to others, really in the market, in the black market. So that is something that also has been an increase in terms of mental health issues.
Nikolai posted a really good follow-up question is, do you notice any differences between men and women or by age, or how do demographics play into some of this, these issues, or not? Or do you have to do something different in how you both reach out to them and treat them as well? You might want to broaden.
Well, regarding age, I saw more middle-aged and baby boomers becoming more anxious and really confining themselves to homes and taking more care not to get the virus. While a lot of population in their 20s and 30s, they became more risk takers, because the message in the start was, this is a disease that will kill people above 50 or 60, while it will be more of asymptomatic in the younger ones. So they took it for granted and took more risk. And some of them were anxious and they acted out in an impulsive way, more younger people.
Gotcha.
Women and men, I haven't seen much difference. Usually anxiety disorder is equally distributed, a little more in women. But I think one good thing was a lot of bonding between mothers and children increased. Mother had more time to see their children at home, to see how they were studying, and there were more communication improved. So certain mothers were very happy actually to see having the children at home and see them thrive in somewhere when they don't get time. Some father had good time bonding with the children. They had a good opportunity. Not everybody took advantage of this, but a lot of people did.
And I got a follow-up question to you guys, to the two of you, please, doctors. Now, one of you is a psychiatrist and the other is a psychologist. Now, can you help us to understand when would a patient see one of you versus the other?
I'll let Dr. Soto deal with it.
Yes, basically the term with psychologist and therapist, basically the core of work is to work with the triggers that may exacerbate a mental health condition. By triggers, I mean dealing with situations, dealing with cognitions or thought patterns. Basically, in therapy, that's what we work more. That is the core of our work with any client that comes to our office to seek benefits for therapy. Basically, we as mental health professionals, therapists, and psychologists, they don't have prescription authority at this moment in the state of Florida. There's other states in the nation that psychologists have prescriptive authority for psychotropics, but not in the state of Florida at this moment. So that is more for psychiatry, which they take care of more medication management. I've seen also a lot of psychiatrists that they also put a little bit of therapeutic work into their practices besides the medication management.
Well, thank you, Dr. Soto. What I've seen in general population, in generally what folks think that if it's a minor stress or if it is something, a stress that they can do through talk, they mainly go for therapy and psychologists and psychotherapists. Another thing is the question of stigma. In general population, the stigma is if they think they go to psychiatrist, they have a major psychiatric issue or psychological issue. While if they go to a psychologist or psychotherapist, that means they have something that is not that major or not that stigmatizing. So I've seen that a lot of patients generally contact, if they have this bias, they contact psychotherapists and psychologists first. And then a lot of times the psychologists, psychotherapists tell them they need medications. While on the other hand, some patients who do more research might decide to get to treatment straight away. And another thing is the economic factor. For example, patients who don't have insurance. Now, to have a talk therapy might take 10 or 15 sessions, which can be expensive compared to psychiatry, where they have a specific anxiety or depressive disorder, and they can be treated in 2-3 sessions. So that is another big factor.
Well, that's really good information because, you know, that was one of our questions about the stigma attached and the reluctance that some people have about seeing mental health. I mean, I had a family member who I was talking to, and I told her, I said, well, you know, you go to a medical doctor when you had physical things, but now we felt that, you know, that this person needed to speak to a mental health profession, but was very reluctant to do that. Finally, you know, she came around, but based on what you all said, it may be easier to get them to go to a psychologist initially, and maybe they'd be a little bit more receptive to doing that versus going straight to a psychiatrist. So that's very good to know.
Because the thing is, the word crazy is used very commonly in our society. Oh, you are crazy, I'm crazy, that is crazy. And we don't want to be labeled crazy. And crazy can mean anything from anxiety to schizophrenia because it's a general, very vague term. So I think that comes into consideration.
Well, speaking of healthcare policy, and Dr. Azam, I think you did mention a minute ago about the cost associated with seeing either one of you guys. Now, with when the Affordable Care Act was rolled out in 2010, I don't know whether he was practicing back then or not, but under the Affordable Care Act, more people got access to health care. And with the policies that the new administration is rolling out, hopefully even more people will get access to affordable health care. Do you find that your patients have access to health care, or are they coming in uninsured?
Well, that's a very interesting question. In 2010-11, I was working with the community mental health in Gainesville, but when I started my private practice in 2012-13 in Miami, at that time, the Affordable Care Act was rolling into practice, yeah? And in the first year, I saw a lot of patients being denied coverage because they had a pre-existing anxiety disorder. Now, for example, if you had an insurance, you started insurance, you go to a psychiatrist, they find out, well, you had anxiety before, we're not going to cover you. A lot of times, I actually got so many requests from insurance policies asking for refund for what they paid for the patient because they had a pre-existing condition and they had a mental health condition. Now, before the Affordable Care Act that we're rolling out, a lot of policies totally excluded mental health condition from the coverage, total. And it was eye-opening because before, in 2010 and 11, I was working with a community in a hospital. I didn't know all these things, but when in private practice, when I was dealing with insurances, I started realizing, wow, Affordable Care Act has really helped access to mental health. Because after that, when it became fully in practice, the Affordable Care Act, no question were asked from patients whether they had anxiety before or not, whether they had been treated or not. They could just go and just like you said, just like they could go to medical doctor, primary care doctor for any kind of asthma, the same thing, they would go and get treated for depression without question asked and without getting authorization. So there's been actually a great improvement that I noticed, yes.
I totally agree with Dr. Azam. There is a huge improvement in coverage and also in helping individuals to have access to mental health or behavioral health services through insurances now with the CARE Act. And people now, they can have at least from 6 to 12 sessions, at least to start initiating therapeutic treatment in terms of psychotherapy. At least that is something. And then you can also, if let's say that the client needs more services, you can go back to the plan and request for additional coverage, and they are willing to accept these recommendations from mental health professionals. So definitely has been a lot of increase in patients being able now to afford mental health coverage.
Well, that's great. And I know the Biden administration is going to go even further in trying to expand the Affordable Care Act, because we know the last administration tried to totally demolish the Affordable Care Act, which would have had a devastating effect on so many people. But it survived barely. And now it looks as though the Biden administration is going to make it even stronger and add more services, and hopefully be able to get it more affordable to people and make it not so expensive. And something else on the cooking blocks is, they are considering providing Medicare down to age 60. So if they can do that, that would be a great asset to people, great advantage to people too. In that 5-year age category. They may not get Medicare for all, that I know a lot of people are advocating, but in incremental steps, if they can move it down to 60 in the next couple of months, then maybe they can move it down even further. So moving right along, Cheryl, you have any other questions?
I wanted to go back to some of the things you've been seeing over the pandemic, because you talked about a lot of anxiety, but one of the things we're either seeing in the news is the rise of addiction and some of the problems there, and even the rise in suicide rates. And personally, I have a colleague whose son committed suicide, and I've heard of through even young people, like my nephews have known some young people that have died, and all of this. So I'm curious, just even for us, warning signs of people we know, any help, ideas, just to keep us more sensitive so that we're more proactive with people that are really suffering.
Well, warning signs, well, I'll take the answer. Warning signs, we should be looking for a friend, family member, somebody, first of all, if somebody starts self-isolating, because addiction behaviors are guilt-ridden behaviors. They are stigmatizing. So a lot of people who start getting indulged in that start self-isolating. Another thing is depression itself leads to self-isolation. Self-isolation leads to poor self-esteem, poor care, poor health, and that leads to further marginalization. And when there's a collective feeling that, well, the world is just changing, things might come to an end, certain patient who might have this severe melancholic depression might start thinking, well, if the world is coming to an end, why not just take it out, take life? The warning signs are anxiety, panic disorder, self-isolation, secretiveness, less socialization, and either also increase in weight or loss of weight. These are certain things I would be looking for.
Thank you.
Something that I think is very important to always pay attention is when someone is having a lot of difficulties and is impacting their general functioning in terms of functioning at work, functioning at home, functioning with social relationships, interpersonal relationships, family and or friends, is a sign that that person should be seeking some kind of mental health advice or help. That is one of the major distinctives, because stress, we all deal with stress. Sadness, we all deal with sadness in a given time. But when those symptoms are having an impact in our functioning, if I am so anxious or so stressed that I don't want to go out of my home, that I prefer to stay isolated at home, then that is a sign, obviously, that I need to get assistance, that I need to get help. If I am sad to the point that I'm thinking about suicidal ideations or even have a plan or attempt, I need to get help. I need to seek for some assistance. Or if I have a family member going through all of this, it will be something that we will take into consideration to help that family member in that particular situation and moment.
Thank you. I think that's great advice. There is one question as we're sort of hopefully on the other with vaccination, and I know there's variants out there and there's possibilities of spikes and everything like that, and the reality of it actually happening. But I am wondering, since so many people are over COVID and as more and more of us get vaccinated, there's a general happiness and joy that comes with that, but there's also some other long-term effects that you might be seeing or that we should be anticipating, both individually or in our communities, and what we need to be aware of from a policy and a political platform. Any thoughts on that? Who wants to go?
Yeah, let Dr. Soto answer.
Okay. You guys are so good sharing this platform. I love it.
Well, basically, there is a lot of financial stressors, a lot of health stressors now as part of this pandemic. But basically, I think that something that we all need to start taking care of and helping not only ourselves, but our family members or friends, the people that we are in contact with, is to help them manage, to help us manage with fears and with anxiety. And some of the things that can be done, for example, is getting the facts. So it's very important to get the facts from reputable sources. Like, for example, the CDC website is now crucial for people that are seeking the facts about the pandemic, the facts about symptoms, the facts about everything that needs to do with COVID-19. Another website that is very helpful is the APA website, American Psychiatric Association. You can find resources not only for yourself, but also to help other individuals. The fact of trying to be healthy, stay healthy, is another component. Keep connected using all this new technology, right? Maybe you cannot go to a person's home, but you can FaceTime, you can do a Zoom meeting with friends. And it's important also to be mindful about our own assumptions about the pandemic. If we are stressed, if we're worried, that is something that we are going to pass to other family members that live in the same household. Another thing, and that I think is another recommendation, will be to help individuals with the screening time related to news, related to social media, related to the pandemic. We need to get the facts, we need to get information, but if it's too overwhelming, we need to put a stop. Let's say I will watch the news, this channel at this time only for 30 minutes, only 1 hour a day, or maybe one day, alternating days. So it's the only way that we can prevent ourselves to have fears and anxiety being unmanaged.
Thank you. Good. All
Well,
great
I would
suggestions.
Well, I would also add that with pandemic, a lot of people have become more aware of their health issues and how much we can be vulnerable. And we can actually advise our patients to get more regular visits with the primary care to check for any underlying conditions, because the main thing in this pandemic was patients who had underlying conditions, they were more prone to severe illness or death. The second thing is about technology. It has revolutionized the technology, and many things can be done now from home and from offices. And prioritizing, a lot of new generation has actually been very intelligent, and they have actually learned lessons from it. One more thing is about vaccination. We need to encourage our patients to vaccinate. A lot of people are anti-vaxxers, and I challenge them. I ask them questions, and they have some very weird ideas. You know, vaccination is one of the key factors that will get us out of it, and we need to convey that. Even the question, I had a patient who was pregnant 2 months ago. She asked me, should she get vaccinated? I said, I really believe she should. And then after a week, the CDC recommendation came, yes, pregnant women should be vaccinated because in pregnancy, corona can be devastating. On top of that, a lot of people who have gone for health screening for wanting to get tested for corona, they got blood tests and they found out, well, they had thyroid problem actually that was not treated for a long time, they had other conditions. So basically the general health is very important, and patients should be advised, and they have learned to start taking care of the health as from the basics.
Great. You know, one of the things we want to talk about, and I know, and both of y'all have touched on it, thank you so much, is regarding, you know, what people can do to, you know, reduce some of the stress that we are seeing out there. And, you know, I know for me personally, staying away from a lot of that chatter on social media that is not always factual, but enough to give you anxiety, and some of the constant chatter on regular TV and cable. I think you know, just an overload of information can just cause too much anxiety with people. And I appreciate that. I mean, other than that, I guess exercising maybe, you know, and I think Dr. Soto-Yulfo said FaceTiming with friends and family, I guess, you know, if you're not ready to go out and meet people. So those are some great suggestions on things that we can do. Because I mean, I don't think anybody can say that during these last, you know, 12 to 15 months that we all haven't felt some anxiety and some depression. I know for me at the beginning, it was, I kind of got used to it over a period of time. But, you know, those first few months of total isolation and the scare factor, because you just didn't know how bad this thing was going to get, or whether you're not, you know, whether or not you're going to get the, you know, the virus or not. It just caused a lot of anxiety. But I think people have begun to feel a little bit better, I hope. And now I understand, though, there you know, there are people who now have gotten so used to staying at home that they have a fear of going back out into the public again. You know, it's kind of like they have this fear of return to normalcy because they've gotten so used to staying at home and isolated that, I mean, that could be a consequence of, you know, of staying at home, and maybe another area that people are going to need treatment. What do you think?
Well, we have to go back to normality, hopefully soon, one way or the other, maybe with modification. Now, we will go to normality, it will be a new normal. Maybe we might not be able to shake hands very confidently, but we can do fist bumping, we can do any kind of greetings. We have, for people who have been vaccinated, people have been angry. Why did we get vaccinated? Why is CDC telling us to still mask up? Well, we have to mask up, but we can go out with less anxiety that we have been vaccinated. So the basic anxiety would be treated, I mean, would be taken care of, but mask would be as a respect for others. Maybe somebody else hasn't been vaccinated. Maybe there's a virus, there's a dormant in the nose of a person who is vaccinated, but that virus can still go in a sneeze and infect another person. However, normalcy will come back. It will be a new normalcy. And a lot of people are intelligent enough. They will form their own way of how to deal with. Some of them will be careful and take a long time to go back to normalcy, while others will mingle in easy. It will depend on individual factors and individual needs. Yeah, that's what my thought was.
Olivia, go ahead.
Yes, Cheryl, I sent you a couple of questions that came from Nikolai. I was wondering if
Yeah, I was, as we were going to open up, I was going to go to Nikolai first.
Hey, Cheryl, you know what? It's 7:45. It's 7:45, and we can open it up now and let Nikolai, anybody, I mean, we said we're going to open up to Q&A at about 7:45.
I think
okay with that, Cheryl.
If Nikolai asked his questions, he had some good ones right there. So if you don't mind, or do you want me to read it?
I think just because of the time, I think I'm more curious about the men's mental health responses. So are men less inclined to get mental health services? If so, what can we as a community do to break down these associated stigmas and encourage them to openly speak about stress, anxiety, stress, and grief, and other types of mental health concerns? Thank you.
I think that activities like this one are very helpful, not only for men, but also for the entire population, to get more information about not only COVID-19, but also with mental health, with what a therapist does, what a psychologist does, what a psychiatrist do. It's very important for us to get access to that information. Dr. Azam was mentioning the word crazy, right? That word is loaded with stigma, and we don't want to be called crazy because we are seeking services, right? So it's important to address that. We cannot change the world, but we can change ourselves and the people that we are surrounded with. We can have these conversations. We can speak about mental health with our friends, with family members. And in a way, we can normalize the experience. People at times, they get services, they receive benefits, but they don't want to talk about it with even their own family members. They want to have everything like in secrecy. And by doing that is continuing the stigma. Let's talk more freely about mental health. Let's talk more freely about disorders, anxiety, depression, PTSD. Those conversations needs to happen. And I'm very glad that this is one example of these conversations that can be done.
I will also add, thanks, Dr. Soto. A lot of men, they have more, because traditionally men are the ones who are breadwinners, they have an ego, they have to be strong. They don't seek treatment for depression, but they might seek treatment for focus issues, anxiety, or anger. And when they seek the treatment, there is an opportunity for us to dig more deeper and encourage them to open up more. And whatever way or shape or form, whether they go to the primary care or to therapists or to psychiatrists, for certain reasons, we need to dig more deeper for what they might not be ready to open up. Yeah.
Okay. A couple other questions were in here about just in general children and or people that have actually had COVID and how that has affected their mental health, either while they have it or afterwards. Any other comments or questions or thoughts?
Well, initially I saw a lot of a great difficulty for parents to deal with children who had learning disabilities, who were going to special schools, because that's where the parents were being helped and the children were taken care of. Now, when those schools closed, the children were creating a mayhem at home. The parents didn't know how to deal with them, and they needed a lot of education. And that was the first thing I saw was children with special needs, special education, needs or special or disabilities. They were being misunderstood at home. They were that was one of the biggest problems that I saw in children and adolescents. A lot of children actually, because of the social media, they do communicate with each other. Like children, I mean middle schoolers or high schoolers, and they adapted by doing FaceTiming or chatting. And some of them. So the schools in Florida did a very good job by giving them the option of opting out and doing home schooling or doing the online or going to the school. So certain children said, we can't deal with it anymore. We have to go to school. I cannot deal with this loneliness at home. And they did go, and with some risk, they did well. And other children who did the online, they also did well. Yeah.
Okay, thank you. Anybody else have some questions? I see Steve made a comment about how addressing the issue of men and the stigma, how a lot more sports figures are taking on mental health and public service announcements. Do you have a follow-up question, or was that just more of a comment? Okay, good one. Any other questions? Anybody else?
I think
Hello?
Angel.
Yeah, a couple things. What I've read, I read something that concerned me quite a bit, and that was that about 50% of people who've had COVID get major depression afterwards, particularly pronounced in younger men rather than older people, as is the usual stereotype. Have you actually encountered that in your practice?
Me, I haven't encountered major depression in younger people after COVID. Basically, most of them were happy they got over it and they were immune. I have seen a lot of patients who had severe COVID complaining of brain fog, anxiety, and unable to focus. And physiologically and pathologically, that is related to the inflammation in the blood vessels, because the COVID virus infects the endothelial, the lining of the blood vessels, and it gets inflamed. And even after patients recover, the inflammation persists, and that leads to constriction of blood vessels. So blood supply to the brain areas that function as focusing or decision making, that gets affected and takes longer time to get better. Depression has generally increased, but patients with COVID, those who have lingering symptoms, yes, their
I think
depression
Dr.
has
Azam
increased
just froze.
and continued.
There he is.
Oh, okay. Can you hear me?
Yes.
Okay. Those patients who recovered fully, they were fine, but patients who had post-COVID syndrome, what we call, or lingering side effect, complication, including brain fog or anxiety, yes, their depression has worsened.
Thank you.
Basically,
I had a follow-up question
what
about.
I've seen basically is more associated with anxiety, but people that had experienced post effects, they kind of lower their anxiety, but the depression increases in terms of thinking about if these symptoms or these after symptoms are to be stayed, are to I'm gonna be suffering from this forever. So that worry turns into into a depression. But I see it more associated with anxiety.
Okay. Well,
Okay,
we're,
just for a time check, you all, we have 5 minutes. If I see, who is that? Tana Marie, I'm sorry, I butchered your name. Tanari, that's right. I remember from the meeting the other day. You have your hand up. Go ahead. I'm sorry.
Thank you. I have the mic off because I'm still dealing with COVID, and I had it off yesterday for you all, the camera, but you don't want to see me today. I am actually angry, and I don't know if this is a form of depression, because I know how careful we've been with this COVID situation. I mean, when the lockdown came, we were totally isolated, total lockdown. And when things opened up, we remained, 6 feet apart, mask, hand sanitizer, the whole 9. And as a matter of fact, I was telling them the other night, my daughter Alejandra, she's the COVID police. We are so serious about this. So I go and do my civic duty and get the first shot, and I ended up with COVID. And I'm devastated because I was really ill. And the thing that really helped me, one time in the hospital, they gave me fluids for dehydration and pain because the cough was just tearing my body apart. And so I ended up getting the infusion, which made a huge difference. But this cough will not go away. And so now I've been placed on an inhaler, and I've never had asthma a day in my life. So my doctor was saying, just give it some time, and you're still gonna have to take some time to recuperate. But I'm stuck in this house, and my sister had to fly from Alabama to take care of my daughter, and she has to leave Saturday. Then my mom is gonna fly in Saturday. So my life has just been turned upside down for being extra careful. So I don't know how to take this.
Well, for people who feel that kind of anxiety, do you think that they may need a session with one of you guys to help work through what this anger feeling that she mentioned that she was feeling, because I guess she did everything right but still got the virus? Do you think that a session would be of use?
Well, anger could be a symptom of many things. Could be due to the long isolation, brewing anxiety that we were trying to cover by saying that we were being careful. Anger could be due to the reality after all this carefulness, still it happened. Now, of course, we gotta take care of anger because it can not only inflict on ourselves, self-inflicting injury, but also it can affect our relationship with others. We have to come to terms with the reality that yes, despite being very careful, sometimes things happen and people get infected because this is a very highly infectious virus. Of course, a talk session will be great to have. I would advise. And if that doesn't lead to any good satisfaction and there are symptoms of anxiety or depression or post-traumatic or anger, that can be treated with medication. Yes.
Yes, basically the fact that we try to protect ourselves is unfortunate when we hear these stories of people that has been very careful, protecting themselves, protecting their family members, and still get the COVID-19. But as Dr. Azam was saying, this is something that is a disease that is very easily transmitted, and we're dealing with a virus. So we can try to protect ourselves, but still there is a percentage of risk, especially when we go out, when we meet other people. So that's why it's important to always get the facts and to continue the protection, to continue the CDC guidelines, continue washing our hands, continue using our mask. Even if you're vaccinated, it doesn't matter. Let's continue taking precautions because we still have this virus around us.
Okay. Cheryl, anything else you want to bring up before we?
I just wanted to thank our panelists and everybody for their brave questions and recognizing their that we also have to take care of ourselves and then the people we love. And as democratic activists, use this kind of information to help fuel our energy and commitment to good policy and good government that helps people.
Good. You know, everybody, I put mine, most people know my email address, but I just put it in the chat. And if anyone want to get in contact with either of the doctors, just drop me an email. Well, I know it's kind of confidential, but I can always get you in touch with them. If you want to contact either one of the doctors. Go ahead, Olivia.
Well, there was one more question, which I wasn't sure if Nikolai wanted to ask that, her second question. And I just noticed that Janet has raised her hand. Thank you, Nikolai. Just wanted to make sure you had the opportunity.
Okay, I'm sorry, go ahead.
Janet has raised her hand. She might have a question.
No, I'm good. Thank you, though.
Okay. You
I
can
have a
unmute.
question. Yeah. One of the things that I've been countering is that as a good sort of citizen, I've been trying to encourage people that I run into who are vaccine hesitant to get the vaccine. And I find that a lot of times those conversations have been difficult, sort of like, you know, just it feels like it's antagonizing, even though you're not trying to. And I'm wondering if you have a suggestion of a good way to approach having that conversation with somebody, because I feel like it's up to all of us to try to get everybody vaccinated so that the whole world can get back to normal.
Basically, I think there's a lot of fear still with vaccination. And something that I personally use is that when I speak to someone about the vaccination or the vaccine, I don't tell them what they have to do. It's more of it's their own thinking that basically is going to help them understand the importance. What we can do is educate them with the facts, with everything that has been already published related to the vaccines, the vaccination process, and basically to help them understand more the technicalities behind the vaccination process and the vaccine itself versus what might be our own fears or our own determination about it, because I can be proactive to vaccination and I vaccinated myself, I went and I had the vaccine, but that doesn't mean that everybody will think the same way. So what I encourage is to let them have the information, the facts. They can go to the CDC website. get information about it and have them make their own decisions. If they have any doubts, if they are eligible, if they can have it or not because of underlying medical condition, it's important for them to contact their own PCPs and to get clearance and get more information from a reputable source.
Well, thank you, Dr. Soto. And also, as the question was, it's a very politically charged question or discussion in certain circles. And even certain patients who tell me, Doc, I'm anti-vaxxer. I tell them, well, I took part in a vaccine study actually. And people told me that I was crazy. I said, well, but I wanted to take part in a study as part of community and also to protect myself. Give examples of people who have done vaccination and they've been protected. Or we can ask them, what is the risk of if you get vaccinated? What is the risk compared to if you don't get vaccinated and you get too much of an illness? Well, just like Dr. Soto said, we can just leave it to them and ask them, just raise the question, what is the risk of not vaccinating compared to vaccinating and get a little bit of side effects, or maybe, and just open up their minds a little bit to scenarios that because of their political leanings, they are just so strict and don't want to think about the other side. We just help them open up a little bit to think, and that might help rather than getting into strict, strong discussions, which could just lead to more antagonism.
Well, on that note, you all, it's a little bit past 8, and this is supposed to be from 7 to 8. And I think we had a very good session tonight. It was very eye-opening. And I want to thank both Dr. Soto-Yulfo, Yulfo, I got Dr. Soto-Yulfo and Dr. Azam, both for participating and joining us tonight and taking time out of their busy schedule to do this for us. So I thank you very much. And to everybody, thank you for coming and participating. And I hope you all have a good night. And please, if you know anybody who need treatment, need care, please encourage them to do it, because it'll really, it'll help them feel better and make you feel like you did the right thing. So good night, everybody. Great program. Good to see everybody. God bless.
Thank you very much.
Thank you.
Appreciate it. Cheers.
Thank you. Bye.
Thank
Thank you,
you.
Dr.
Bye-bye.
Raul
Thank
and
you.
Sharif.
Thank you.
Thank you. Appreciate it. Cheers. Thank you.
Thank you, Bill. Thank you, Cheryl.
Thank you.
Great session.
Yeah, absolutely. Very informative. Thank you.
You still recording?
Mhm.